N-O-T Tobacco Teen Cessation Program. The N-O-T Tobacco N-O-T program was selected as a model program by the Center for Disease Control and Prevention, CDC. It originated from the West Virginia University Centers for Public Health Research and Training. This is a school-based smoking cessation program designed for youth ages 14 to 19 years old who smoke every day. These smokers are statistically either wanting to or trying to quit smoking. N-O-T incorporates training in self-management and stimulus control, social skills and social influence, stress management, relapse prevention, and techniques to manage nicotine withdrawal, weight, family, and peer pressure. These health determinants are essentially the reasoning behind this evidence-based practice. This program integrates a combination of these influences to understand and evaluate the thoughts and efforts of teenagers in this program. N-O-T can be and has been implemented by schools and other community organizations. The N-O-T program was specifically designed to reduce smoking in children who are between the ages of 14 to 19 years old. In other words, teenagers. Teenagers are among the most easily influenced of all populations. Due to an increasingly high number of young smokers, this program has been shown to have a significant impact on the communities and schools affected. This program has shown a substantial decrease in smoking among teenagers. With that being said, this decrease has been measured in terms of an increased amount of smoking cessation in the population and a reduction in smoking practices altogether. This program has been successfully dispersed throughout schools and communities. Fortunately, this program has been proven to be beneficial in several settings. The N-O-T program has been recognized by the National Registry of Effective Programs, which shows and proves its effectiveness. Health and social factors are determinants of all programs in the public health field. Once an issue is discovered, a needs assessment is carefully calculated. From this needs assessment, an intervention is developed and eventually implemented. Although there are some teenagers who have no interest in stopping their smoking habits, the N-O-T program has significantly impacted the communities in which it has been implemented in a positive manner based on the statistical data obtained by the study of this program. Despite public health efforts to prevent tobacco use among youth, nearly 1/4 of teens report smoking cigarettes, and over 2/3 say they would like to quit. For some time, however, little attention was given to developing programs to help teenagers quit smoking. Social factors are an important contributing factor in a teenager's decision-making process. In a teenager's decision, most of the time there is peer pressure or pressure to fit in. Therefore, social groups can positively and negatively affect a person's decisions. Cessation practices look to stop smoking, whether that's a sign on the building, a smoke-free campus, or a specific place where smokers can smoke. All are common practices, especially for businesses. Some companies limit the amount of smoke breaks a person can take and when they can take them. Others go as far as asking during the interview process if they are smokers. All of these practices support anti-smoking goals. However, the celebrities and role models focus their attention on anti-tobacco advertisements. The younger generation seems to relate better. Peers can also hinder a young person's actions and encourage poor behaviors. Similarly, celebrities and role models can also negatively affect a person's perception of smoking and deem it cool. Whether there are more ways companies are trying. The author of this article, John R. Polito, writes, but a careful reading of the research leaves you wondering, in how many other areas is the American Lung Association misrepresenting the facts? What possible motive could it have been for claiming an ineffective program as highly effective? And how could the CDC read the same studies and yet hold N-O-T up as a model program? Unfortunately for Mr. Polito, this is his own interpretation of the information and is not rooted in fact. However, he does present information that would be helpful to ensure the program's effectiveness. For example, ensuring the facilitators of the program have adequate training and that the program is well understood by all. The program is easily scalable to other communities. It focuses on important health concerns that involve all, as well as creating safe spaces for teens to discuss their habits. As far as recruitment, I've explained specific areas of focus, including demographics, in order to ensure relatability to all potential participants. The references.